I want to help you elevate your life financially and create generational wealth. Hey, it's Brandon, Mr. Finance, the Millionaire Maker, looking to make who? You. That's right, you a millionaire too. If you want to replace active income with passive income, if you need business funding, or if you would like to make $3,000 to $13,000 a month every 30 days for the next 1 to 2 years, tune in to Brandon, Mr. Finance, the Millionaire Maker on Saturdays from 2 to 3 p.m. on WVON 1690. One-on-one appointments can be booked at brandonmrfinance.com.
It's the Wake Up Show with the Illinois Black Chamber of Commerce on Chicago's essential storyteller, WVON.
Welcome to the Wake Up Show, Chicago.
Rise and shine. It's the Wake Up Show, where every sunrise is a call to action. Powered by the Illinois State Black Chamber of Commerce, we are the champions of change, advocating for diversity, equity, inclusion, and accessibility in the world of corporate and government contracting. It's not just a show, it's a movement. So get ready for another dynamic journey as we wake up the world to a new era of opportunities and empowerment. Ladies and gentlemen, Larry
And good morning, everyone. Everyone listening within the sound of my voice, I want to say good morning to you. We want to say good morning to you because it is the Wake Up Show Chicago. I am one of the hosts, LaDonna Ray of Ray Consulting, and this is all there to. You hear some feedback, so whoever, Larry, go ahead and mute your mic just for a second, and then as soon as there we go, we getting it in today. But no, you're listening to the Wake Up Show Chicago. We are hosted by Wind Creek Casino in Chicago, and or should I say in Chicago Southland. And we are powered by the Illinois State Black Chamber of Commerce. And just I'm one half of this. We want to thank you guys. Go on to our social media, which is the Wake Up Show Chicago. You can also go to our website, ilbcc.org, if you want to become a member and get more involved with the chamber. And I am co-host to our CEO and founder and chairman of the board, Mr. Larry Ivory. Good morning, Larry. Now you can unmute your mic. There it is. Good morning.
Okay. Good morning. Good morning. Hey, it's exciting to be on the show again. And I think I probably got a little bit of feedback, so I
Yeah.
may have to call in. I'm in Baltimore right now. So I'm going to hang up with Donna. You continue the show, and I'm going to call in and see if we can get rid of this background noise.
Okay. Yeah. You know the number.
Yeah.
All right. Well, not only do we have, of course, our chairman of the board and our CEO and founder, Larry Ivory. Our wake up show comes on each and every Saturday, and you can tune in on WVON 1690 each and every Saturday at 9 a.m. But we have a very special guest. Before I give you his name, I want you to save this number in your phone. And that is 773-591-1690. So we are ready to dive into this conversation. But before I do so, let me go ahead and introduce our special guest. Joining us today is a man who is not just talking about it, he's building solutions. He's a physician, a public health leader, an entrepreneur, and the founder of SimpCo, a company bringing together over 100 Black businesses to tackle healthcare disparities and economic inequities. Please join me in welcoming Dr. Jeffery Sterling. Good morning.
Good morning. How are you, LaDonna?
Man, you know what? After talking to you each and every time, I feel more empowered. So I am doing swell. Thank you for asking. How are you?
Always on it, always doing it, always fantastic. Thanks for asking.
Of course. And Larry's back on the line. Hey, Larry.
Hey, how you doing, Donna Ray, and to Dr. Sterling? Hey, I'm excited. Last week we talked a little bit about the conversation about health, but health is more than just a conversation on healthcare disparity. What we're talking about, from my perspective, is the issue of economics as well as health. and why this is such an important topic, why we spend time on it. Because when we take a look at all the money's being spent in healthcare, and we take a look at not just the disparities in healthcare outcomes, but the disparity in income. And Dr. Sterling's whole system allows us a chance to overcome a lot of things that I think has a very negative impact upon the community. So I'm excited when we have a solution that really makes sense for the state of Illinois because it saves money, that makes sense for Black people and other people because you're doing preventive care instead of sick care. And then when you take a look at what it does, the economic impact of all the opportunities and jobs that it creates when you are participating in the economic prosperity of healthcare. So that's why this subject is so important to the Illinois State Black Chamber of Commerce. That's why we're going to continue to talk about it, because trillions of dollars are being spent, and we're not participating nearly at the level that we should. And when we have someone that has a solution to that problem, I think it's important for us to not only to talk about it, but be a champion for it.
Absolutely. And Dr. Sterling, when we hear the term healthcare disparities thrown around so loosely, but many people don't really know what that means and how deeply it impacts our community. Can you explain that to us?
Sure. The general concept of a healthcare disparity is that when you look at outcomes, the production of things that we care about, such as life expectancy, such as the incidences of different diseases within communities, a disparity is when one group is disproportionately affected in whatever that statistic is that's being studied. And as luck would have it, you can pretty much put your name in a hat and pull anything out, and Blacks would represent a healthcare disparity in this country. That's why the phrase, when America gets a cough, Black America gets pneumonia, arose. If you looked at the top 10 causes of death in the United States, Blacks are disproportionately affected by 8 or 9 of them. So disparities are more the rule than the exception, and it's about time that we took control of matters ourselves and fashioned solutions to pull ourselves out of the situation that the healthcare system in this country has put us in.
Yeah. And Larry, you have spoken about how you want to bridge the gap, and this is like data and dollars basically. So if we connect the dots, people, guys, those of you that are listening, Dr. Sterling, how does this conversation about health tie directly into Black economics and business opportunities?
Well, that's a lot. And let's just start by letting people appreciate that this is important, because if America was honest about its real mantra, it's about life, liberty, and the pursuit of health, wealth, and happiness. There's an interchange in all of those things. And, Larry hinted at it, but I'll give you the actual numbers. In America this year, we're targeted to spend about $4.8 trillion on healthcare. It is the largest industry in this country relative to the gross domestic product. Over 20 cents of every dollar spent in this country is spent on healthcare. And it's not just going to doctors. Well, it's especially not going to doctors and nurses. There's an entire healthcare industry that is separate than the healthcare service delivery concept that we think about when we think about healthcare. There are tremendous amounts of wealth being generated. Every insurance company that you can think of is on the Fortune 500 list. The tallest buildings in the country are insurance companies, and none of those are owned by Blacks. None of those are significantly contributed to financially by Blacks. Just think about that for a second. And even at home in Illinois, about $25 billion a year is being spent on healthcare. And the Black participation in that amount amounts to roughly 100 million with an M. The data is not good, and that has important ramifications, both from the economic consideration, which the chamber is keen to discuss, but also because the public health data is very clear on the notion that better healthcare outcomes are produced when that healthcare is being delivered in a culturally sensitive, if not specific manner. And that simply means that we do better in terms of eradicating healthcare disparities and producing favorable healthcare outcomes when there are Black physicians and nurses and Black-owned businesses that are overseeing care that's being delivered to our communities. So the SimpCo solution is meant to deal with both of those considerations at the same time, all toward the desired end result of producing better healthcare outcomes for communities up and down the state.
Larry?
Dr. Sterling, one of the things that, we always talk about how do we create the win-win-win situation within the chamber. So what I'm going to do is simply let's talk about the win for the state. And when we talk about when budgets are tight and and people are trying to find ways of cutting costs, but at the same time not cutting services. When you think in terms of healthcare prevention, and if you take a look at the countries who are doing the best, what would you say their mix is in terms of healthcare prevention and sick care? How do we rank in terms of that? And where is if you were asking in the investment philosophy, what's our portfolio mix that we use for preventive care, sick care, best models, and how they have, where they're at?
Yeah, great question. Whether we're talking economics or whether we're talking about the production of health, healthcare, by the way, is different than medical care. I'm sure we'll tease that at some point. But the answer to the question is to be found starting from the same place. An ounce of prevention is worth a pound of cure. So the win for the state, the state has a limited amount of dollars to invest in all of its goods and services, including healthcare. So if you're talking about a good government consideration, if you're talking about bending the cost curve, and being a good steward of your taxpayer dollars, you would actually realize pretty quickly that investing in health prevention and health promotion on the front end is way more cost efficient, way more cost effective, and way more it's better in allowing the citizens to have a higher quality of life than waiting for disease to present and then you engaging in curative care, also known as sick care. So the win for the state is that you have productive members of society that aren't spending their time in the most expensive portals of entry, the emergency department, and getting surgeries and other such things. It's quite simple. And by the way, the SimpCo solution is nothing more than the implementation of best practices in health prevention and health promotion, which is why we've been around so long to talk about this and why we've had the degree of success that we've had. Everything that we're doing is acknowledged as a public health best practice, and there's really no dispute about that. So from a governmental policy standpoint, if you're designing a system to produce better healthcare outcomes and better economic healthcare outcomes, this is what you would do. You would start with health prevention and promotion. So that's the win for the state.
Yeah. So let me just, Dr. Sterling, I'm going to add on to that. When you take a look at your track record, you have been involved in this industry and you have implemented this around the world. Can you give us some examples of maybe some of the things that you've done in other countries as an example? Because I think that warrants, if we're doing it someplace else, I think that means something.
I first had this conversation back in the fall of 2013 in the state of Illinois. I remember it like it was yesterday with then Senator Donnie Trotter, who was head of the Senate Appropriations Committee. At that time, I was in the middle of what was a 13-year stint of providing telehealth and telemedicine in Tokyo to IBM. Shortly thereafter, I actually participated in what still has been the largest implementation of a universal healthcare program in the world over in Indonesia. And, the long and short of it is that one of the things that distinguishes the design and implementation of healthcare systems around the rest of the world compared to the United States is the amount of money being spent. As I said, over $4.5 trillion is being spent in the U.S. to the tune of a 21% tap on the gross domestic product. The rest of the world struggles to contribute 2 to 3% of their gross domestic product towards healthcare. The richest countries do 4%. At the United States, which is at 21%, the next most expensive system spends only about 11%, and that's France, Switzerland, countries like that. But the long and short of it is that when you don't have a lot of money to spend, meaning that either you're going to be frugal with your money or you simply don't have a lot of money, you always are going to begin the conversation by saying, what's the most cost effective and what's the most clinically effective way of delivering healthcare? And that's always a conversation about health prevention and health promotion. If you're waiting until people get sick, then you're going to have to spend money for surgeries, for disease management and treatment, multiple chemotherapy, radiotherapies, and other types of things to deal with cancer. We can forestall all of that by doing this. And, to be fair, we've gotten quite a decent reception in the state of Illinois. The agencies do get it. The Department of Public Health, the Department of Health and Family Services have been keen to this conversation because when we have it with them, we're professionals talking about best practices, and that's the language that everyone understands. But yes, this is a conversation that has been had around the world, Larry. As you know, we're currently having it with a half a dozen different countries on the African continent because this is how you produce health. This is how you produce better healthcare outcomes.
Dr. Sterling, did
And
you? Oh, go ahead, Larry.
go ahead,
Sorry.
Lazada.
I
No,
was
you go ahead,
gonna. I
Lazada.
just want to make sure that people, here comes SimpCo. Yeah, it just sounds like the right thing to do, and the answer to both our health crisis and our economic stagnation. Would you tell us that, or what SimpCo solution is really about when it comes to that? I know you touched on
Sure.
it, but I want our audience to understand the driving force behind SimpCo.
Sure. Now let's start. Those are two conversations. One is the delivery of services, preventive health services, and the other is the economic impact that will create in delivering those services. So, first of all, the acronym SIMCO includes Managed Preventive Care Organization. In the state of Illinois, everyone's familiar with managed care organizations. They deliver medical care and maintenance and other services regarding medical care. SIMCO actually doesn't do that. We operate in parallel to bring together all of the best practices in health prevention and health promotion and deliver them under one roof as the practice of preventive health. Now, what we are very interested in doing, this goes back to the first question about healthcare disparities, because the state of Illinois is actually in the bottom half of states in terms of the production of healthcare outcomes, but has long been known to be one of the most innovative states in terms of healthcare delivery. So it stands to reason that Illinois would have jumped all over this to keep consistent with this past tradition. But what we're talking about doing is engaging people. We want to literally transform a community of citizens within the state, particularly in communities ravaged by healthcare disparities and impacted by the social determinants of health. Our facilities are meant to be buildings that are not clinics, but literally nearly the size of hospitals where we deal with hundreds of people at a time every single day. Within these health and human service centers, which is what they're called, we actually will have health education, the access to um, things that help you learn how to eat nutritionally. You'll actually get clinical practice in doing those types of things. There are spaces for exercise and activity. We'll talk about mental health and mental stress. You'll have access to agencies that provide services that address the social determinants of health, smoking cessation, job creation, literacy. All of these things impact health, and dealing with them on the front end produces better outcomes on the back end. So we are literally going to the people, engaging in hand-to-hand combat to teach people how to be better stewards of their own healthcare. As we like to say, stay ready so you don't have to get ready. And one of the things that distinguishes SIMCO is that we believe that nothing about you should be done without you. So we're real keen on providing culturally sensitive services wherever we are so that people can meet this information where they live, incorporate it into their daily lives, and move it forward. Because, I always like to throw this part in because people do things without necessarily thinking about them, and we want to teach them to do better. Just to give you one example, um, our community, the Black community, engages in what I call a modified, evolved post-slavery diet. The way in which we eat really is a remnant of the way we were forced to eat when we didn't have access to food back when we were enslaved. And then we seasoned food beyond recognition so it became palatable. Well, the consequences of having done that for generations is the large numbers of hypertension and diabetes and other healthcare disparities. It's time for us to reprogram the way in which we interact as a community, what we value as a community, and let ourselves be known as a community that relishes and cherishes and implements strategies that produce better health. And we're going to do that community by community in which we're invited to participate. That's the clinical challenge that's in front of us, to literally transform the state of Illinois into a state that worships and practices health prevention and promotion.
I love it. Sounds like SimpCo is like a preventative care powerhouse. And those of you that are listening, don't forget you can call in live at 773-591-1690. Larry Ivory with the Illinois State Black Chamber of Commerce. This is your baby, but I want to make sure, Larry, that you get in how our listeners can basically get more involved in the SimpCo solution and the Illinois State Black Chamber of Commerce. How can we put the two together?
Well, let me just ask this other question before we get into that, LaDonna.
Okay.
Is that, one of the things we try to make sure when we're on the show is to inform our audience so that they can be more informed and we can protect them. That's really what radio and news is all about. And one of the things that I want to get across to our audience, like when you have a car, you can buy a very expensive car, you can buy any car. And matter of fact, I can tell my own story about my daughter and my 740 AE BMW that is sitting on the sidelines now because someone didn't put oil in it when I let her use it. And now I need a brand new engine. It is far more expensive because we did not maintain it. And the bodies are the same way, if I'm not mistaken, Dr. Sterling. So if we don't take care of our vehicles, eventually we got to replace the transmission, we got to replace the engine, and it's far more expensive. If we had did the maintenance, we would not have to go to the emergency room and get a heart transplant or do something else. Would that be fairly correct in terms of analysis of why health prevention should be a significant portion of our strategy? And I'll add this on a comment. If I was a person who was politically motivated, and because I think healthcare is such a big issue, it seems like America, someone who would say, look, let me grab this. If I want to become senator, president of the United States, something, I would grab this, say, I've gotten this thing figured out, because it seems like any of the states are doing this very well. If Illinois does it, we become the model. And I think that's such an incredible opportunity for us where everybody says they got it figured out. And somewhere in Illinois, they're doing it better than everybody else. And it's saving money, driving the cost of healthcare, improving life expectancy. I would think that would be an enormous victory for anyone.
Well, you're right. I'm sorry.
No, go right ahead, Dr. Sterling.
Yeah, so the first part of what you said was exactly an ounce of prevention is worth a pound of cure. The package that we've put together to deliver these healthcare services to the state is priced at about 20 cents on the dollar compared to what's currently being paid for the managed care organization service delivery products. And I would dare say that an objective view of the data really shows that preventive health actually produces better healthcare outcomes than waiting until disease presents and trying to deal with it through that prism. I have to give a hat tip here to the state of Illinois in this regard. We've met with pretty much the entire congressional delegation from the state of Illinois, and there's a fair amount of excitement about doing what you said, about taking this nationally. We've had conversations with the Illinois delegation, both on the Democratic and Republican side, and they are interested in co-sponsoring legislation as a delegation to take this program nationally. Because if you are looking, we talk about fraud, waste, and abuse. I don't know about that conversation in this context, but the long and short of it is that if you were interested in an efficient, there always get to efficiency in all these conversations. If you're talking about efficiency in government, good government, at some point in time, you're going to have to talk about bending the cost curve away from the more expensive uses of your money toward stuff that produces a better outcome at a lower cost. And that's exactly what this is. So actually, I wouldn't be surprised. And I actually would love the opportunity to help the governor, the congressional delegation, or anyone else use this model as part of the national conversation on how to provide better healthcare services for the country. Because quiet as it's kept, although the United States is number one by far in terms of the amount of money spent on medical care and in the percentage of its GDP that's spent on medical care, it's in the low 30s in terms of production of healthcare outcomes relative to other systems around the world. So there's plenty of room for improvement, and there's no reason at all that the state of Illinois shouldn't be at the forefront in producing those improvements.
Now, we've got a couple of callers. Larry, did you want to go ahead and take those callers?
Well, let me ask this question real quick before we take the callers, Donna, because we definitely want to hear from our callers. But Dr. Sterling, when we take a look at best practices and we take a look at where the U.S. is at in terms of best practices, our portfolio mix is really out of balance. And I guess the only thing I'm trying to get to, and the point I'm making and continue to try to make, is the fact that we have a lot more money being put in sick care and a lot less money being spent in preventive care. And if we're taking a look at long-term trend, being, a past investment banker with Merrill Lynch and Solomon Barney, you understand the trends, that as people do what they do, it has a longer economic impact. So not only do we get the immediate impact, but we get the long-term economic impact at the same time, which I think is even greater from an economic perspective.
Well, let me pick up on what you're putting down there because there's two important points that I'll try to make quickly here. Number one, this is a business show, we need to actually understand that the United States is more interested in the healthcare industry even than it is healthcare delivery. This is the largest sector of the U.S. economy. As the healthcare industry goes, so does the U.S. economy. As I said, there are tons of managed care organizations and other insurance companies in the Fortune 500, okay, with the largest buildings in the country. Healthcare actually kept the country afloat during the pandemic. So, in terms of that, that's something that is viewed very favorably by the United States Department of Commerce. Now, on the other hand, that's not a good thing if you're talking about Black businesses that aren't participating, because we tend to think of, healthcare, that's doctors and nurses. Well, actually, no, it's tons of businesses inside of the healthcare system, and we haven't been participating. And that's why the SimpCo Solutions other part of the conversation is about creating scaling to capacity by introducing dozens of not over 100 different Black businesses to participate so that we can get out of the habit of always participating as subcontractors and really get skills that allow us to participate as primes. So the economic conversation in the United States, Larry, actually is the conversation. Healthcare outcomes are produced as an offshoot of the exchange of commerce.
But how can Black business owners play a role in improving health outcomes? Because that's pretty important.
Well, once again, that's such a beautiful question because it actually reflects, with all due respect, the type of confusion that we come to this conversation with. The interaction between a doctor and a patient is so little of healthcare. Go think back to the Affordable Care Act. One of the biggest things that happened in the Affordable Care Act is that then President Obama noticed that only 45 cents of every dollar that you pay in insurance or that the government contributed toward healthcare was being spent on patient care. There's so many other industries involved in that. And the Affordable Care Act actually mandated that that number would be increased to 85 cents on every dollar that the government was contributing toward healthcare. It had to be spent on direct patient care. There's so many things that happen in the background. In our example, I know one of the callers, Winona Redmond with Win-Win Communications, wants to talk about her participation and how, as I said before, we're trying to transform a community. So that involves marketing, that involves public relations. Those are very important parts of the conversations. There are cottage industries everywhere, telehealth, telemedicine. Then there are support industries such as accounting, legal. If you are in business, you can contribute. We talk about wanting to feed people and teach them how to eat healthily. There's tons of restaurants that will participate in the SimpCo solution so that we can migrate away from only eating things that are fried and fatty. So there's plenty of ways to get inside of the healthcare dollar, not just being a healthcare practitioner.
Hey, Dr. Sterling, if I can chime in real quick. This is Lorenzo, I'm one of the producers producing the show. My background is in clinical and orthopedic healthcare. So, so mainly I focused on homeopathic and manual therapies. You asked a question, LaDonna asked a question of how do businesses get involved? One of the things that I had in place in the relationships I had with businesses is helping them understand how the employees that they employed, their health was very important to, the production of the employees that they worked with. So I had a relationship with a lot of businesses that referred a lot of their employees to me for corrective therapies and preventative therapies. And I agree with everything you guys are saying, because I believe education is very important in spearheading, this movement, because so many people don't understand the goal of allopathic medicine and homeopathic medicine. They have two different goals. and they don't know the importance of preventative therapy. So I guess one of my questions is, what type of machine do we have in place? From my experience, what machines do we have in place to encourage the federal government and businesses to focus on the importance of homeopathic or preventative therapies in keeping their troops on the playing field?
I'm going to respectfully frame your question as if it was being spoken with irony, because that's the entire point. United States, more than most other countries around the world, does not do that. And therein lies the opportunity. We have to continue to make the case that this is the path forward. This is why there's a huge disparity, no pun intended, between the amount of money spent and the healthcare outcomes that are produced in the United States. And I haven't gotten into the weeds and won't in the interest of time, but things like what you're saying is employee health programs, wellness programs, occupational health programs, disease management programs. These are the types of micro industries that exist in health prevention. There's primary prevention, secondary prevention, and tertiary prevention. There's a ton of stuff that you don't get to do when you go visit your primary care physician, and he only has 15 minutes between patients, and 2/3 of that has to be done with documenting the interaction. So that's what we're bringing to the table. But the hand-to-hand combat that SimpCo is involved in is simply educating the public, educating legislators, and getting people to appreciate that you can do well by doing good. Industry doesn't have to suffer just because we're focusing on health prevention and promotion, and we should be doing all of the above.
All right. Well, I'm going to get.
Take those calls.
Yeah, I was going to say, hey, Kay. Good morning, Kay. Welcome to the Wake Up Show, Chicago. You have a question?
I do. Good morning, Miss LaDonna. Can you hear me?
I sure can, loud and clear.
Good morning. I love hearing you in the afternoon.
Oh, thank you, Kay. Thank you so much.
I have two questions. Well, I have a question that's not really related to healthcare, and then have a healthcare question. I work with a security company that's trying to get their certifications to get city and state grants. How would they go about getting help to do that? Like filling out the application and all of that.
Let's take what we'll do. LaDonna will take your name down, and they'll get your number. Then we'll call back.
Oh, okay. Let me do my healthcare. Let me do my healthcare question. I'm in healthcare, and the gentleman that talked about healthcare being the largest industry and how they flourished during COVID. I work at a local hospital, and I went to work every day, so we didn't get off. So I wanted to know what type of businesses, I think he said it, but what kind of businesses could people have to tap into the healthcare dollars? Like supply chain, being able to, get supplies and different things. What are the businesses that can tap into that are not doctors?
Any business. There's a path for any business. If you think about a building, let's just say that our services are being provided in the building. Whatever business you're in that provides services to buildings would be applicable here. Whether you're IT, whether you're janitorial, whether you're food delivery, the healthcare dollar is spent in many different ways. And the information forums, the vendor fairs that we've been having for the last couple of years drive home that point. And basically what we ask people to do is that if you are in business, I chair the health industry group for the chamber. If you are in business, connect with us so that we can find a way for you to participate. We aren't just going to have a list and say, if you are this, that, or the other, get in. We're trying to grow Black business by our position as primes, and that's part of the SimpCo solution as well, creating economic empowerment and opportunities for the community.
So I could connect with the chamber to get into the healthcare industry?
Of course.
Okay, I'll do that. Thank you so much. Y'all are having a great show. Show.
Okay, we're going to grab your information. We may have just lost her. I was going to have Shapira grab her information. But, Kay, you can go ahead and make a inbox us on our social media if you like, or you can email us at info@ilbcc.org. All right, we're going to go to the next caller. We got Yvette. Good morning, Yvette. Welcome to the Wake Up Show,
Good morning.
Chicago.
How are you?
Doing well.
Good. I am just excited about the program because we have been, I have Real Men Charities and the founder of Real Men co-founder, and we are interested in definitely using our facility that we own, the quarry, to do more. We have about at least once a month, maybe sometimes twice a month, health programs, as well as something for aging well and happily with by connecting. We call it the Vitality Village at the quarry. And I was just wondering, could SimpCo come out and talk to us or partner with us to take us from 1 day to 3 days a week, because it is so important that people are able to talk about preventative activities, changes in their family lifestyle, et cetera. And sometimes the face-to-face makes all the difference.
That's such a great, thank you for that call and for those comments. That's exactly the point. What SimpCo is doing that distinguishes us from efforts elsewhere is that we're taking all of the best practices and putting them under one roof. There's so many different preventive and public health organizations out there that are doing pieces of the SimpCo solution, but we're creating a managed preventive care organization, and we want to go into communities. We actually want to. We're seeking you out. We want to participate with you and help you do what you do. That's part of the cultural sensitivity, where we fashion solutions community by community so that people understand the importance of health prevention and health promotion. So please get us your information, and we'll be happy to talk and network, get involved, and participate toward our desired end result.
All right, Yvette, if you're listening, I couldn't get to you fast enough. If you could go ahead and inbox us on our social media or email us at info@ilbcc.org. And again, that's Yvette. Please do so. Anyone else listening as well, but send us an email. It's info@ilbcc.org. All right, we got one more caller, guys. Morrow, good morning.
Good morning. How are you?
Doing well. Welcome to the Wake Up Show, Chicago.
Thank you. I was listening to the economic impacts and had to kind of note a couple things. One, right now we're at 20% of gross domestic product for healthcare costs. And back in 1970, when our economy was much smaller, our total percentage of money spent on healthcare was only 6%. So we're not only seeing a growth in the percentage, but that's also compounded by the growth of the economy. And so I just want to say that, the efforts that Dr. Sterling is mentioning is certainly going a very long way towards not only helping, just the healthcare economy, but there's also the fact that if we're spending 20% now, that's probably only going to grow as America continues to age. And so it's extremely important not only to the people, but also to the economy as a whole, because that means that businesses and everything else are contributing, governments, businesses, and everything else are contributing more of their money towards healthcare costs instead of towards research and development, instead of towards, bringing new products to bear, instead of doing other things that could help their citizens like infrastructure and roads. So this effort that Dr. Sterling and the team are undertaking actually has really broad implications, and healthcare is not the only aspect of that. So certainly we want to see that go forward. And
Hey, Marlo, absolutely right. Let me just say this real quick, and then I'm going to pass it back to Dr. Sterling and Donna. What I'm most concerned about is the cost of my costs going up, because as that cost continues to spiral, that means that I have to spend more money on healthcare because insurance is going to go up in order to pass it on to consumers. So the impact is not just on business, because business normally will pass that cost on to consumers. So we have to, as individuals, be concerned about where the care of health, just like the cost of education, if it continues to go up, some people can't afford it. So we have to do something. This is a national security issue. Quite frankly, if we don't get healthcare under control and keep the costs down, then we're going to continue to divert money into healthcare, where we need to be converting into utilities and keeping our doors open. So I think it's really critical. And I'm not being overly dramatic, is that it is a national security issue when you think about the cost and looking into the future.
Well, actually, Larry, your comments are understated, not overstated. In the current environment, and we haven't talked about the public health part of this conversation much at all, but in the current environment where tens of thousands of jobs are being cut from the Department of Health and Human Services, the Food and Drug Administration, and the Center for Disease Control and Prevention, the government is downsizing, and research is being dramatically reduced for issues of importance to us. What all of that means is that now you better pay attention. Now is the time for communities, particularly those already beset with healthcare disparities and subject to social determinants of health. Now is the time where you better learn how to be the best steward of your own healthcare, where you had better learn how to stay ready so you don't have to try to get ready, stay well so you don't have to get well, because the government is not going to indefinitely be in the business of healthcare. We have done it for the last several generations because it has stimulated the economy beyond recognition. But we are getting to a point now where the entire budget of the United States can't be on healthcare. So the efforts, to some extent, that are occurring nationally are meant to bend the cost curve. That's a phrase that means something, to produce efficiencies, to produce better outcomes while spending less money. And a lot of that is going to rest on our individual abilities to not live sick lives, because that's pretty much what we do. We forget about health until we get a disease, and then we run around looking for a magic pill. No, we need some fruits and vegetables, some stress management, and some activity and exercise in our life as part of the way in which we live our lives, not as a disease management proposition, but just being mindful and placing healthcare as a higher priority in our lives. That's where we have to get to.
Yeah. You know what, Dr. Sterling, too, and look down into our listening audience, when I think about the money in terms of advertising and marketing, like when marketing company is the store, we have to begin to recondition people, and marketing and being able to help them to understand, like you do me all the time, Dr. Sterling, and again, I value and appreciate the fact that you're always concerned about my health. That, Larry, look, you got to drop some weight, you got to do some things, you send me books, and it's helped me to extend my life expectancy. And without that help, quite frankly, I don't, the outcome for me would probably be, I'm not sure how long none of us got to live, but the fact of the matter is we have to do a better job of our health, in terms of what we eat, what we exercise, what we read, and we spend very little time thinking about healthcare in these areas. So I just want to applaud you for being in a strategic industry that has so much value. And then I hearken the state of Illinois, who's done a good job, but we haven't got it over the finish line. I want to be able to celebrate with the leadership and the governor, everyone else, that we are leading the pack when it comes to this issue, and that it becomes a national model for the rest of the country. I just think it's so important.
Well, I would be remiss if I didn't say thank you to the Legislative Black Caucus and the General Assembly, who in fact have passed the SimpCo solution into the budget each of the last 3 years. But it's also fair to say, as you pointed out, Larry, that money hasn't hit the street in the way intended. This is meant to be a grand endeavor to improve the lives of the citizens of the state. There's a real opportunity to improve healthcare outcomes. And, this is a Chamber of Commerce show, so I need to make sure that the dots are connected here. The bottom line in this conversation is that we will produce better healthcare outcomes when Black businesses combine to produce culturally sensitive and specifically delivered solutions to our community. The things that we're talking about now that people tend not to think about when it comes to health, well, nobody's going to have those conversations other than a SimpCo. And that's why we need to find ways to get into this country's largest industry. So if you are in business, and you see healthcare fairs or healthcare business opportunities out there, no matter what you're doing, that's where the money is. That's why Jesse James robbed the bank. That's why you go into healthcare, because if you're not, I always like to tell Larry jokingly, if you're not looking at healthcare, then you're not serious about being in business, because that is by far more than IT, more than construction. That's where the money's being spent in this country. And let's do it. Let's do it so that we can produce better healthcare outcomes for our community and for the state in general.
All right. Well, Larry, I want to make sure that because we have a little bit of time, and circling back to that one question where I was asking for the audience to understand how the Chamber and SimpCo are working together. Are you able to just put that into terms where they understand the importance of SimpCo and the importance of the Illinois State Black Chamber of Commerce and how they're working together on getting this out to the people and to better our communities?
Well, the ultimate goal of the chamber is to help Black businesses to grow and expand and become even more successful. And what SimpCo Solution does, under Dr. Sterling being the prime, it creates an enormous opportunity for African American business owners to participate in contract. And you talk about millions of dollars of contracting that would be done that would help grow those businesses and continue, because we're certain, I'm certain that the trend is going to have to be, that we're going to have to do more on the preventive care side than what we have in the past. So we think there's we want to get in front of the curve, not behind the curve. So why it's so important to us is that all our businesses can participate in this. And when you think about all the stuff that we can focus on, why this would be a priority for us, because it helps hundreds of businesses to scale up and to have an opportunity to grow. And that's why the correlation, outside of the fact that, healthier people is more productive in our community and all the other factors. So when you really get right down to it, LaDonna, and to all our listening audience, this just makes good business sense. It just makes sense, and it's in our best interest to pursue this endeavor and put time and energy into it, because the outcome, the savings, the benefit to the state, the benefit to the people, and the benefit to business and the overall economy is pretty significant.
You see, this is why it's important to point out that. I'm sorry, Larry. This is nothing about this has anything to do with charity. This isn't even a reparations consideration. This is about excellence. We're talking about taking the best practices in health prevention and health promotion, bringing them all together and delivering them under one roof. And in doing that, we will produce better outcomes than the state has been able to produce otherwise. We will do this by spending dramatically less money than the state currently spends on all of its wonderful efforts to provide health to the citizens. The business relevance to this conversation is that I am because we are, as the African proverb says. The pursuit of excellence in providing culturally sensitive information and services to our community lies in our excellence. It lies in our ability to come together. And, everybody says stuff like, I know my family, I know what works for my family. I know my body, I know what works in my family and in my community. We are operationalizing that concept. We are gathering as a community to deliver services to each of the communities inside of the state in a way that is culturally sensitive. That is what, again, my training, my education in health policy and design, in addition to being a physician, obviously. And if you're going to devise a system that provides healthcare outcomes community by community, this is the approach. So to the young lady that asked, how do I get involved? The answer is yes. We need you to get involved, because every component of service delivery requires some cultural sensitivity, because even the way in which the treatment rooms may be designed, for example, they need to be culturally hip and happening so that people will want to be there. Our facilities aren't meant to be state physician offices. They're actually going to be community gathering centers where we have 12 hours a day of learning, where we have lectures about any and everything that we want. Dr. Carol Adams is our community engagement head, and her work across the state is just legendary. And the point of all of that is that we're going to meet you where we are, but realize where we're trying to take you. We're taking you to better healthcare outcomes in a way that matches who we are as a people. And we're going to elevate our community economically and in terms of healthcare outcomes during the process. That's the SimpCo solution.
Love it. Larry, we have a question from one of our members. Can I read it?
Sure, go right ahead.
Okay, Jerry Zerong says, here's another good question to ask. How does healthcare and the Veterans Administration relate to the American troops, not only for their health, but their mental well-being?
Yeah, mind, body, and soul are connected. I mean, there's only so many chemicals and molecules in the universe, and we all interact. I'm not going to get metaphysical on you, but the long and short of it is that, post-traumatic stress disorder is a real thing when it comes to veterans, and it's a real thing for communities. And in the African American community, we spend zero time talking about the post-traumatic stress that is generational on the basis of having been enslaved. As I said, there are three big buckets in which we produce improved healthcare outcomes. There's not dieting, but healthy eating. Okay. There's activity, and if you get around to it, exercise. And the other is effective stress management. So, and that involves avoidance, optimization of your environments to reduce it, and then effective dealing with it. So the question addressed the last conversation. We actually are not going to be doing this in a silo. It's our intention to work with universities, with hospitals, with anyone that cares about health. We want to be able to deliver, the very first book I wrote had a very simple message, despite all of the stories that were involved. How you come out of a disease presentation is in large part, perhaps more than any other consideration, based on how you walked into the situation. So if we can create a higher baseline of health in Illinois communities, that will actually bode well for the inevitability of disease presentations. And that's true for the VA, that's true for the Black community, Latino, white community, wherever. If we are a state that is defined by health prevention and health promotion, we'll do better not only in terms of producing better healthcare outcomes, but in the economics of healthcare.
Great. Well,
Dr. Sterling, and I just want to echo again how privileged we are to have you doing what you do and keeping this alive, because I doubt that we would be having this conversation at the level we're having it without your leadership in this particular area. So again, my hat's off to you. LaDonna, back to you.
Well, I was just going to remind you guys that you can go to ilbcc.org. We're coming up. It's 9:58. We got a couple of minutes, but I want to definitely close with Dr. Sterling, letting everyone know what they need to do. If you want them to find your book or go to your website, please, now is the time. And then we'll let everybody know how to follow and keep up with the chamber.
Well, I just want to make one final point. I know we're running out of time, so I'll be quick with it. This isn't just business. This isn't just charity. This is desperation. This is survival. My life is entirely possible because of access to education and access to healthcare. Hard stop. The bottom line here is that nobody's happiest day of their life was on a day in which they were ill. And if you want to have more happy days in your lives, if you want to have a higher quality of life, you better get about the business of bringing some health into your life. Healthcare and medical care are not the same. Learn the difference. Get some healthcare into your life, and it starts with how we eat. If you want to reach out to me, get me at jefferysterlingmd.com. The SimpCo Solution .com is where you will find information about SimpCo, and you can easily access me and or SimpCo through the chamber. We are here all day, every day, looking to improve the lives of citizens, and we welcome your participation. And thank you for your support. And next time you conveniently talk to one of your state legislators, tell them thank you for supporting the SimpCo solution, and thank you for helping to facilitate our ongoing growth in the state of Illinois.
Well, that's it. It's that time. Larry, any closing remarks?
No, hey, I just think it's, again, so important. Thank WVON for giving us this opportunity to tell our story that is relevant to the African-American community. And we continue to endeavor to bring real content that we believe have a positive impact upon our community. And we will endeavor to continue to do that on an ongoing basis. Look forward to any comments that people have. Please feel free, if we're not hitting a subject that you think is tied to Black business, call us, let us know, so that we can address those issues. And that's what it's about, strengthening Black businesses, strengthening Black people, strengthening Black communities, and also strengthening America.
All right. Remember, the Wake Up Show Chicago is powered by the Illinois State Black Chamber of Commerce, where we advocate, educate, and create opportunities for Black businesses across the state. Be sure to keep listening to WVON 1690. And if you miss it, you can go to our social media and check it out. Go to ilbcc.org. And we want to thank our sponsors, Wind Creek Casino, Southland Chicago. And that's it. I'm LaDonna Ray. I'll see you guys Monday right here on WVON 1690.
Get ready to wake up to the pulse of progress as we amplify voices, break barriers, and illuminate the path towards a more inclusive tomorrow. Follow us across the socials at The Wake Up Show Chicago. Be sure to like, subscribe, and share. It's The Wake Up Show every Saturday morning at 9, where change begins with every sunrise.
Welcome to the Wake Up Show, Chicago.
That's the end?
The talk of Chicago is 1690 WVON, Sherwin, Chicago.
Did you know a woman's risk of breast cancer nearly doubles if she has a first-degree relative? That's a mother, sister, or daughter who has been diagnosed with breast cancer. October is Breast Cancer Awareness Month. Schedule your mammogram today.
Greetings, Boomtown. Ever since this neighborhood switched to Xfinity Internet,
the Wi-Fi is booming!
Xfinity combines the power of internet and mobile with one all-in plan.
So we've all got lightning-fast, secure Wi-Fi speeds at home and on the go with Wi-Fi Power Boost from Xfinity Mobile.
You get the most reliable Wi-Fi with our best in-class equipment and unlimited data included. Plus, add an unlimited mobile line.
All for only $40 a month for 1 year. To celebrate this combo, we're mashing our shows together.
It's everything you need all in one plan. Plus, learn how to get a free 5G phone with a premium unlimited line. Now, sit back and relax with the smooth, relaxing sound
of face-melting acid metal!
Brilliant.
Visit Xfinity.com to learn more. Ends June 23rd with paperless billing and autopay to stored bank account. Restrictions apply. Xfinity Internet gateway required. Taxes, fees extra. After 1 year rate increases to $110 a month. After 2 years, regular rates apply. Actual Wi-Fi speeds vary. Most reliable Wi-Fi based on Open Signal Awards USA. Fixed Broadband Experience Report, August 2024.
It's time to focus with Robert McKay. Quality conversation, protecting, preserving, and preparing our past, present, and future. Sunday evenings at 4 p.m. on the Talk of Chicago, 1690 WVON. It's Rainbow Push's Saturday Morning Forum on Chicago's essential storyteller, WVON.
Great odds. The push is on. The push is on. The push is on.